coronavirus deaths linked to the nursing facility. That's the focal point of the coronavirus outbreak.
I want them to know that the community, the world, everyone is thinking about them.
Today, flowers and encouragement for those inside as life care officials address challenges fighting the virus.
We feel like we're still in triage in what's happening here.
And the call to action from the governor to help stop coronavirus from spreading. Grant County is now reporting its first coronavirus death. That brings the state's total to 19 deaths out of 136 confirmed coronavirus cases across Washington. There are now confirmed cases of coronavirus in King, Snohomish, Grant, Jefferson, Pierce, Kittitas, and Clark counties, with the majority of them in King County. Now, the majority of our state's deaths are all linked to the same nursing facility in King County, and our team's coverage on the coronavirus starts with KIRO 7's Deborah Horn. She is live at the Life Care Center in Kirkland. And Deborah, families of people in that facility must be getting more anxious by the day.
And Lindsay, many of them, some of them anyway, have been showing up here at the Life Care Center for the daily news briefings the center is now having. Many of them remain critical of how the facility is handling this crisis. But as you will soon see, things are changing quickly here, leaving in its wake much sadness. It happened again late today. 2 residents of the Life Care Center loaded into an ambulance, presumably for the short trip to the hospital.
What's really getting me really upset and sad is that these elderly are dying alone. They're dying alone and they're dying afraid.
Lauren Applewood is so moved she brought flowers. Her own father lived here until last October when she moved him to be closer to her Bellevue home. Yet she feels for those who remain. Even though your father is not here anymore.
Absolutely. Even though my dad doesn't live here anymore, I still feel a part of the Life Care Center family.
Those who still are a part of that family say they are troubled. Vahe Gazarov says his 87-year-old grandmother is fine, but he thinks Life Care mishandled the crisis.
It's common sense. If you see it, you should have shut down the facility, allowed nobody to go in and out. But they continued operating.
It's unpredictable for us.
Life Care spokesman Tim Killian says they are still trying to get a handle on the disease. Coronavirus can claim its victims quickly. The medic units that showed up here today, an indication Killian has said that someone's condition has changed, something that can happen in a matter of hours.
It was surprising and shocking to us that we have seen that level of escalation of symptoms to death that quickly.
But this nurse who volunteered to leave her Life Care Puyallup job to work here sees signs of hope. What did you find when you went in yesterday? Was it getting better?
Yes. People perked up, looking better, feeling better, eating, drinking.
And they are getting more help. The Fed sent medical workers and supplies to help fill in the gaps. But as you have seen, as we have seen almost every day that we have been here, the crisis here is far from over. Reporting live in Kirkland, Deborah Horn, KIRO 7 News.
Thank you, Deborah. Schools and universities around our region are taking action to prevent the spread of the virus. Tomorrow, the University of Washington will move all of its classes online after a staff member tested positive for coronavirus. That will last through the end of this quarter. Some of the other schools holding online classes include Pacific Lutheran University, Seattle University, Seattle Pacific University, Shoreline Community College, and Northeastern University, Seattle. Tacoma's Lyon Elementary announced yesterday that it will close for several days of cleaning because a staff member tested positive for the virus. The plan is to reopen the school by Wednesday. You can find the latest school changes on the KIRO 7 News app in the main coronavirus story. Today on Face the Nation, Governor Jay Inslee said the state is considering using its emergency powers to impose mandatory social distancing measures that have so far been voluntary. KIRO 7's Michael Spears is live in downtown Seattle tonight. And Michael, any decision along those lines will certainly impact the economy.
Shutting down large events, gathering schools, absolutely, Lindsay. But researchers say it did work in China to help prevent the spread of the coronavirus. And today the governor said our state is now considering what that could look like as far as mandatory social distancing here in our state.
I really don't care too much what Donald Trump thinks of me.
From politics to more pressing matters.
We are thinking about stronger measures right now.
Governor Jay Inslee appeared on Face the Nation Sunday, talking more seriously about using the state's emergency powers to impose mandatory social distancing, which could temporarily mark the end to large gatherings, including closing schools, in order to help curb the spread of the coronavirus.
We are contemplating some next steps, particularly to protect our vulnerable populations in our nursing homes and like, and we are looking to determine whether mandatory measures are required.
Italy recently put in place social distancing measures, locking down millions of people there, including closing cultural sites.
The next step means quarantine?
Not necessarily quarantine, but reducing the number of social activities that are going on. And we need to make decisions about that looking forward.
Leading coronavirus researchers like Samuel Scarpino at Northeastern University said those measures worked wonders for China.
Seattle is much earlier on in the outbreak than anywhere in China. However, because these pathogens can spread and grow very rapidly in terms of the number of cases, we need to be taking decisive action now to prevent a scenario where we end up having sizable number of cases, in the thousands in the Seattle area.
Now, while the governor's spokesperson said no final decision was made today about mandatory social distancing, the governor himself says in the future and now his team will be looking at the models of the infection rate, which will factor into any future decisions on any possible mandatory social distancing. For now, we're live in downtown Seattle. I'm Michael Spears, Cairo 7 News.
Thank you, Michael. One place where people will have trouble keeping their distance from each other, public transit. King County Metro is rolling out a change to try to help keep passengers safe. When you ride, you will now hear an announcement that says, in part, Metro buses are disinfected daily. Help keep yourself and others healthy. Don't travel if you're sick. Cover your cough or sneeze. Avoid touching your face. Wash your hands frequently and thoroughly. King County Metro is also working to keep buses safe by spraying high-grade disinfectant, and they tell us cleaning them more often. With more than 500 confirmed cases of coronavirus in the United States right now, federal efforts are now focused on reducing the severity of the outbreak. 7 weeks after the first case in the United States was identified here in Washington, the virus has now spread to more than 30 states and the District of Columbia. Federal health agencies focused on preventing the spread of COVID-19 within the U.S. are now looking to provide assistance to the growing number of local communities grappling with the virus.
Now we're shifting into a mitigation phase, which means that we're helping communities understand you're going to see more cases. Unfortunately, you're going to see more deaths, but that doesn't mean that we should panic.
Efforts to create more coronavirus tests have been ramped up in recent days. The Trump administration now says another 2 million tests will be available tomorrow, and that by the end of the week, there will be over 4 million tests. So if you have a coronavirus-related question, a Washington call center is now ready to help, and that includes questions about how it spreads and what to do if you have symptoms. Just call the number there on your screen, 1-800-525-0127.